In this video, we're going to cover a detailed overview of schizophrenia, where we're going to understand what schizophrenia is, its symptoms, what causes it, and how we can treat it. But before we begin, I want to mention that we can call it schizophrenia or schizophrenia, but for simplicity's sake, I'm going to call it schizophrenia. Schizophrenia is a chronic psychotic disorder primarily characterized by the inability to distinguish reality from fantasy due to symptoms such as delusions and hallucinations. And because of this, patients with schizophrenia often have disturbances in thinking, emotions, behavior, and perception. The term schizophrenia translates to split mind, and because of this, it is often mistaken for another disorder called dissociative identity disorder, or DID for short. In this case, split mind doesn't mean multiple personalities or alter egos. It refers to the split in intellectual and emotional aspects of personality. It affects 1 in 100 people, affects males slightly more than females, and the age of onset is usually between the late teens and early 20s. Schizophrenia is a greatly stigmatized illness. Most patients are misunderstood to be dangerous or intellectually deficient, and some label them as monsters. However, that is far from the reality of this illness. It's more accurate to say that oftentimes there is a tremendous amount of fear and paranoia that they feel due to the voices only they can hear, oftentimes threatening to harm them or their loved ones, making them feel that they can only trust themselves, and in the process, they withdraw from the outside world. This often leads to stigma-related withdrawal from friends and family. In fact, only a minority of them exhibit violent behavior, and because of the inner turmoil they experience, up to 10% of them commit suicide. That's why understanding this illness can help us break the stigma around it, and as healthcare professionals, to deliver the best treatment to help improve, even if slightly, the patient's quality of life. Now, diagnosing schizophrenia patients is harder than with other illnesses, as the exact nature of the symptoms varies greatly for each patient. However, we can categorize the common and prevalent symptoms into positive symptoms and negative symptoms. I'm going to begin by saying that positive symptoms doesn't mean that the patient has schizophrenia and negative means that they don't. No. Positive symptoms are those symptoms that are either an excess of already normal behavior or are present in addition to normal behavior, whereas negative symptoms are those which indicate a deficit in normal behavior. Let's begin by talking about the positive symptoms, which we can also call active phase symptoms. Delusions are false beliefs that the patient is convinced are real, even when presented with evidence to prove otherwise. Delusions are basically persistent and resolute thoughts that are irrational and untrue. Schizophrenic delusions can come in many shapes and forms, such as delusions of persecution, where the patient is convinced that other people, even family members, are trying to harm or slander them, or are plotting something against them. Delusions of reference, where the patient believes that other people, books, TV characters, or billboards are specifically sending them messages or are talking specifically to them. And delusions of grandeur, in which the patient believes that they are unusually powerful, that they can save the world, or they were brought into the world on a special mission. Depending on the culture, delusions of grandeur can range from the patient boasting highly of their own importance and contribution to the world, to believing they are religious leaders and that they are immortal. Hallucinations are the experience of hearing, seeing, feeling, or smelling something that does not exist. There is no external stimulus to warrant for such hallucinations. For example, the patient might hear voices giving them orders, or conspiring to harm them. Auditory hallucinations are the most common type of schizophrenic hallucinations. Now, I want to stop here for a second and make sure that we understand what the difference is between delusions and hallucinations, because it used to confuse so many of my classmates at university, including myself. My professor used to tell us that delusions involve only one thing, which are thoughts, whereas hallucinations involve all the 5 senses: hearing, sight, touch, smell, and taste. Hallucinations might even be visceral, meaning that the patient may feel pain in their internal organs. For example, they might feel that their brain is on fire, or that there is a cutting sensation in their body. Something else that I also want to highlight is that just because a person has delusions doesn't mean that they have schizophrenia. Delusions alone are not a key indicator for diagnosing schizophrenia. Hallucinations, though, are one of the key indicators for a schizophrenia diagnosis. Disorganized speech is also another prevalent symptom. It can be really hard to understand what the patient is trying to say, especially when they make up words, repeat words or sentences based on how they sound together, something that we call clanging. They might say something like, "come into the house," "louse," "mouse," etc. The patient might also express themselves in jumbled, extremely incoherent mixture of words, something that we call a word salad, and in this way, it can be difficult to understand the purpose or conclusion of the message they are trying to convey. The patient may appear to not respond to external stimulus or to anybody for that matter, and they might not move at all. Or they might move wildly in agitation, both extremes indicating catatonia. Moving on to the negative symptoms. The patient often exhibits something we call a flat affect, meaning that in situations we would expect them to show emotions, they wear an expressionless look, speak in a monotone voice, or appear unfazed by their surroundings. Although the emotions might not show on the outside, they might be responding on the inside. Therefore, it's not that they lack emotions, they just find it difficult to express emotions. The patient might show inappropriate or excessive emotions. For example, they might laugh upon hearing of a family member's death, or they might feel burdened by thoughts of tending to all the visitors at the funeral rather than grieving the loss of their loved one. They might experience anhedonia, which is the inability to feel pleasure, or avolition, which is a lack of drive or interest to perform even the most mundane daily tasks. They often withdraw from social relationships, perhaps due to paranoia, again, the constant delusions of people plotting something against them, or because of low self-esteem. Some patients do have insight into the illness. They understand they're suffering from schizophrenia, and they know that they're different from others, so they don't want to be rejected for it. It's difficult for them to maintain attention, so they're often distracted. Oftentimes, they do lack an insight into the illness, meaning that they don't even know that they suffer from schizophrenia. So you might hear them saying unrealistic things like, "aliens talk to me. You wouldn't understand because you're not special, or you're not the chosen one." Finally, they interpret words literally. So if you were to joke around with them and say something like, "I'm going to kill you," they'll actually believe you're going to kill them. So already, we can see that the symptoms vary from patient to patient. To properly diagnose a patient with schizophrenia, they must possess schizophrenia symptoms for at least 6 months. 1 month of those 6 months consisting of at least 2 active phase symptoms from either delusions, hallucinations, or disorganized speech. While the exact cause of schizophrenia is not yet known, there are many theories and hypotheses on it, so I'll be covering the most common ones. The first hypothesis is the neurodevelopmental hypothesis, which basically states that any impairments to the fetus's nervous system can lead to the patient developing schizophrenia later in their life. These impairments develop in the prenatal environment, meaning when the fetus is still in the mother's womb. If the mother is poorly nourished during her pregnancy, if she has undergone a very extremely stressful situation, if she is exposed to any viral infections, especially during the second trimester of her pregnancy, if she faces pregnancy complications such as bleeding or delivery complications such as asphyxia, then all of these are risk factors of the fetus developing schizophrenia during their teenage to young adult years. The most important observable impairments to the brain structures are a shrunken hippocampus and enlarged fluid-filled ventricles. This diagram is a side-by-side comparison of the brains of two twins. On the left-hand side is the brain of the schizophrenic twin, and we can clearly see that the ventricles are enlarged compared to that of the healthy twin on the right-hand side. Genes also play a role in developing schizophrenia. People with parents or siblings who have schizophrenia have a higher risk of developing it themselves. If schizophrenia were controlled entirely by genes, then identical twins would have it 100% of the time, and fraternal twins 50% of the time. However, that is not the case. If we take a look at this chart here, then the risk of developing schizophrenia for identical twins as a percentage is 48%, indicating that even amongst identical twins, there's a possibility of one sibling developing schizophrenia. As the degree of relativity decreases, the chances of developing the illness also decreases. The dopamine hypothesis of schizophrenia states that schizophrenia is caused by the excessive release of dopamine in certain areas of the brain, as illustrated in this diagram. This hypothesis is backed up by the fact that when patients are given drugs that are known to increase dopamine levels, there is an increase in schizophrenic behavior, and vice versa. The stress vulnerability model states that patients who are biologically vulnerable to schizophrenia will only develop the illness upon exposure to a trigger. For example, if they are exposed to environmental or emotional stress at critical periods of their development, for example during puberty, there is a high chance of them developing the illness. Note as well that schizophrenia is worsened by stress and causes stress. Finally, sociocultural factors can influence the illness. Factors such as stress, poor nutrition, social isolation, and growing up in a dysfunctional family environment can contribute to developing the illness. While there is no cure for schizophrenia, or to be accurate, only few recover from it entirely, there are many treatment courses. The primary treatment is prescribing antipsychotic drugs, which act to decrease dopamine levels and therefore decrease schizophrenic behavior. Neuroleptics include chlorpromazine, haloperidol, respirodone, and olanzapine. Cognitive behavioral therapy can help change the patient's thoughts and improve their internal environment. Family therapy aims to reduce a negative family environment by educating the parents about the illness and its management. Social skills training also helps to improve the patient's communication skills to ease their interaction with others. And finally, if the psychosis is severe, the patient must be hospitalized to ensure their safety. And that will be all for this video.